Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Farzak Kabar bin Fazil with metric number A208409. Today, I will talk about vaping addicts, harm community health, and must take responsibility by quitting. Strawberry milkshake used to be a sweet treat. Today, it is a vape flavor targeting teens and it is working. According to the Ministry of Health, in 2023, 68% of Malaysian teens who vape say flavor like this got them started. I understand, quitting is not easy, but when our choice harm others, pollute the air they breathe, and threaten their future, is it really just a personal choice anymore? Many people think vaping is just a personal habit. They believe it only affects the person who does it, but that is not true anymore. I understand why some say it is their right to vape, but when that choice starts to hurt others, it becomes everyone's problem. As I researched more on this issue, I was shocked by how vaping is tearing apart our communities. I read reports from the Ministry of Health and Berita Harian about teenagers fainting in school and families having a hard time dealing with it. This is not just a personal issue, but it is a growing crisis. As someone who cares about our generation and the next, I had to speak up, and so should you. You might think, I don't vape, so this isn't my problem. But vaping affects us all. Even if you do not vape, someone close to you might. When the damage hits home, it may be too late to act. People addicted to vaping must take responsibility and quit. It is because this addiction is no longer just personal, it is harming the health, safety, and future of everyone around us. In my speech today, I will explain how vaping is not just a personal habit, but a serious public health threat that places a heavy burden on Malaysia's healthcare system and economy. Next, I will propose an incentive program to effectively combat vaping in our country. Finally, I will highlight the wide range benefits this action can bring to the health, environment, and future of our entire community. Let us start by examining how vaping poses a serious threat to our healthcare system. Vaping is putting a huge and unstable strain on Malaysia's healthcare system. A 2024 New Straits Times report revealed that since 2019, the Ministry of Health has recorded 41 cases of vaping-associated lung injury. On average, each patient spends around 12 days of hospitalization and ends up to 150,000 ringgit in treatment costs. These are serious cases involving intensive care, advanced procedure, and multiple specialists. This places a heavy burden on hospitals that are already struggling managing their other health demands. In the same report, the Health Minister warned that if vaping trend continue, Malaysia could be spending 368 million ringgit annually by 2030 on treatment alone. This will result from other critical healthcare priorities like chronic control. The financial burden of vaping extends far beyond just lung injuries. A 2025 court report revealed that treating smoking-related illness, including those caused by vaping, now costs Malaysia 8 billion ringgit a year. That is nearly 4 times what the government earns from tobacco taxes, creating a huge financial gap. These rising costs are draining taxpayer funds and putting the future of our public healthcare system at serious risk. Now that we have seen how vape addiction is overwhelming our healthcare system and draining national resources, let us consider a practical solution that targets the vape users themselves. Instead of just banning products, Malaysia should start a quit to win program that gives real support to people who want to stop. The Malaysian government should introduce a national program that rewards vape users who successfully quit using structured milestones, real-world benefits, and public recognition to reinforce their commitment. A 2024 Cochrane review found that smokers who were given small rewards like cash or vouchers under $100 were almost 50% more likely to quit than those who did not get anything. Even small incentives help them stay nicotine-free for longer. This shows that giving the right kind of support can change real behavior. In Malaysia, the scale of addiction is serious. According to the 2023 Global Adult Tobacco Survey, 5.8% of adults mostly aged 15 to 24 now use e-cigarettes, and vaping has increased by 600% over the 12 years. While 41% of adults say they do not plan to quit, half of young vapers regret starting and want to stop, but many of them do not have the tools or support to quit. A reward program could give them a clear reason to try. The proposed Quit to Win program would offer vape users tangible reward as they hit specific milestones. For example, someone who remains vape-free for 30 days could receive a 20 ringgit food voucher or a public transport discount. At the 3-month and 6-month marks, participants could earn a certificate of achievement recognized by employees, schools, or universities. These rewards are simple but meaningful. They provide immediate motivation and help vape users rebuild their self-image not as addicts but as individuals who are taking control of their life. Other countries have shown this works. In the UK, the Stop Smoking Service gave shopping vouchers to pregnant women and low-income smokers. A 2022 NHS report found that this raised raised by 30%. This result shows that structured reward-based program lead to real measurable change. If Malaysia adopt a similar model, we can reduce vape addiction without relying only on bans or penalties. With this incentive program in place, we can begin to reverse the damage caused by vaping and unlock meaningful benefit for our society. First, an incentive program to quit vaping will deliver health, economic, and environmental benefits to all Malaysians. The most immediate benefit will be better public health and less pressure on our healthcare system. By reducing e-cigarettes addiction, we can expect a drop in lung injuries and other vaping-related conditions. Additionally, our hospital and healthcare workers can redirect their efforts toward managing chronic disease, caring for the elderly, and addressing other pressing medical needs. This will ensure more efficient and accessible healthcare for everyone. Second, economically, incentive programs are also far more affordable than treatment for vaping-related illness. The cost-benefit ratio is clear. As mentioned earlier, a single EVD case can cost up to 150,000 ringgit per patient. In contrast, supporting one person through an incentive program may cost just 200 ringgit. The government can prevent serious illness at a fraction of the cost by investing in quitting rather than treatment. The money saved could be redirected toward more urgent health priorities such as cancer care, mental health service, and maternal health. This investment would directly improve the quality of life for countless Malaysians. From an environmental perspective, reducing vape consumption also means reducing waste in Malaysia. Vapes generate significant electronic waste. The plastic casing, metal components, and batteries often end up in landfills or polluting our environment because they are not recycled properly. An incentive program would help reduce this harmful e-waste. Eliminating waste will appeal atmosphere for Malaysians to enjoy. In conclusion, it is clear how vaping has evolved from a seemingly harmless trend into a serious public threat that affects not just individuals but entire communities across Malaysia. What started as personal choice now carries consequences that ripple through our healthcare system, our youth, and our society as a whole. We have seen how vaping causes an unstable burden on healthcare resources, especially with rising deaths among young people. We have also explored how an incentive program can effectively reduce vaping's harmful effect. If you vape, this is your chance to take that first step. This is not just for you, but for the people who care about you. Quitting is tough, but it does not have to be lonely. A national quitting program could reward your effort with things that really help, like food vouchers, transport discount, or a certificate that opens door for school or work. Talk to your doctor or counselor or someone who you trust to get started. And if someone close to you vape, do not judge them and just be there. Encourage them, support them, and help make sure they have access to programs that lift people up instead of pushing them away. When we support each other, quitting becomes possible, and our whole community gets stronger. While vaping may seem like a personal habit to some, I will agree that when it harms others and strains our society, it becomes our responsibility. Just as we protect our loved ones from their other danger, we must protect them to ensure vaping does not steal away their health, their dreams, and our collective future. That's all from me. Thank you. Assalamualaikum warahmatullahi